We are live, doctor.
Okay. Shall I have the presentation? Yeah. So good evening, friends, and welcome to this first semi-finals. Yeah. Let me share the screen once. Okay. So good evening, postgraduates, and welcome to this Pan-India Intercollegiate Postgraduate Quiz, which is being hosted by Brain Teaser team in association with Ophthalmological Society of Nagpur. And this Pan-India quiz is called the Big Q. And this is the famous.
साला कुछ जीतना ही नहीं
छोड़ छाड़ के सारे छप्पर हट समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So once more, good evening, friends, and my pranam to all the mentors. Brain Teaser team welcomes you to this first semi-final of this fourth season of Big Q. Well, Brain Teaser is an online platform which has been hosting quizzes for ophthalmologists of our country since last 6 years, or say 6 seasons, I should say. And it was since last 3 years. In fact, we started an exclusive quiz for postgraduates with the aim of getting all the postgraduates from our country on a single platform. We have been lucky, and we are really thankful to Ophthalmological Society of Nagpur for having associated with Brain Teaser team and allowing us to do under their aegis. Here in this particular fourth season, we had 6 preliminary rounds, 4 quarterfinal, and today is the first semi-finals. After this, we will have one more semi-final and then one final. This are being aired on alternate Wednesdays at 7:30 p.m. So one more semi-final, which is what you have to look forward to. In this particular season, we were lucky to have more than 350 teams which have participated, and it was very very severely contested quiz this season as well. And out of 350 plus teams, 80 played the 4 quarterfinals, 20 in each team. And now we are having top 20 teams for the semi-finals. Each semi-final will play the 10 amongst them. Brain Teaser team is extremely thankful to the team of quiz masters who toil hard to create a wonderful experience of learning with fun for all of you. Today's episode, we have the quiz masters who have been associated with us since last few seasons. Let me welcome Dr. Prashobh Mohan, who is currently working as a medical director of iBank Dr. Prashobh Mohan is currently in the UK. This was his older association when he was in Kerala. So he's now, what I should say, an NRI quiz master. Dr. Annapurna Kumar, who is a postgraduate teacher at Arvind Eye Hospital, Pondicherry. And Dr. Akshay Nair, who is a director of ophthalmic plastic surgery and ocular oncology services at Mumbai, Dr. Agrawal's group of eye hospital. We are lucky to have a strong financial support from pharma industry. This time it is His Highness who is partnering with us in this particular venture. We are sincerely thankful to Mr. Suryanarayan, Mr. Naresh, Mr. Kautub, and the whole team of His Highness for helping us enroll all the postgraduates and getting them ready for this particular platform. Of course, my words fall short to express my gratitude to Sai and his Numerotech team who have been responsible for smooth and flawless execution of this Brain Teaser platform. So now, without much ado, Let me request my co-quiz master, co-host, Dr. Shilpi Narnavre, to familiarize all the participants with the rules of the quiz. Over to you, Shilpi.
So, good evening, friends. Welcome back for this season of Big Q. And today is the first semi-final. So, in the semi-finals, there are total 20 teams who are playing. So, 10 teams per semi-final. So, today is the first semi-final, and second semi-final will be on the 18th of June at same time, that is 7:30 p.m. So, like previous episodes, for teams, you have to log in from the two devices, that is the Kahoot and the Zoom platform. The first screen is the live quizzing on the Zoom platform, and the second screen is the Kahoot, which is for the MCQ round, and it is played by both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. So from today's semi-final, out of the 10 teams, 5 will qualify for the finals, and the qualifying criteria is the respective semi-final marks. So coming to the rules, so we have 3 sets of MCQs. Each set will have 5 questions, have to be played by both the teams and the audience. There is no negative marking in this round, and you will get 10 seconds per question. Rapid fire round only for the teams. So you'll have to answer 5 questions in 30 seconds time. Correct response, you will get plus 10, and for incorrect response, you will get minus 5. And if you say pass, there will be no marks. The third is the case-based round, that is also only for the teams. In this, you will be given one case scenario with the image-based question. It will be image-based round. You will have to answer 3 questions in 30 seconds time. And like the rapid fire round, for every correct response, you will get plus 10. And for incorrect, it will be minus 5. And for no answer, there will be no marks, either given or deducted. So teams who are not playing today's semi-final, they can play as an audience in private practitioner category. So now I have the honor to introduce our first quiz master, Dr. Prashobh Mohan sir. He has done his MBBS from Dr. SMCSI Medical College, Thiruvananthapuram, MS Ophthalmology from RIO Thiruvananthapuram. He has done his fellowship in cornea and external eye diseases. He worked as consultant cornea and refractive surgery in several of the large tertiary care centers in Kerala. He served as a medical director of Eye Bank Association Kerala and Swarnam Eye and Ananta Eye Bank. Presently, he is a consultant ophthalmologist with special interest in cornea at Northern Care Alliance NHS Foundation Trust, UK. He is an avid quizzer and quiz master, and he has won the many awards at the state and national level for quiz competitions. So with this, I hand over the screen to Dr. Prashobh.
Thank you, Dr. Shilpi, for that kind introduction. And thank you, Dr. Prashant and OSN for inviting me to be a quiz master. It's a privilege to be your quiz master. Can we go on to the quiz?
Yes, sir.
Right, we start with the first set. This is the first question. So there's a 68-year-old gentleman with mild blurring of vision in the right eye. Please look at the fundus picture and the B scan with the A scan overlaid and tell me what is the most appropriate next step in the management. Your options are, is it FFA? Is it an ICG? Is it OCTA? Or is it D, the CT chest? Time starts now. I hope you got the answer right. So the right answer is D, CT chest. As you can see, this is a case of a choroidal metastasis, and which shows high reflectivity on the B scan. And the most common site of the primary lesion in males is the lung, and in females, it's the breast. We will move on to the next question. Please look at the fundus pictures and the OCT image. This is a 33-year-old gentleman with bilateral diminution of vision. What is the least appropriate step in management? Please note, which is the least appropriate step. So, option A, IV methylprednisolone. Option B, FFA. C, enhanced depth imaging. Or D, micropulse laser. Your time starts now. Yes, we've come to the end of the time. The right answer is A, IV methylprednisolone. And this is a case of a bilateral multifocal CSCR. And as you know, IV steroids can worsen this condition. FFA is useful to differentiate it from Vogt-Koyanagi-Harada syndrome. And enhanced depth imaging shows choroidal thickening in CSCR. And micropulse laser has been shown to reduce the central retinal thickness and improve visual acuity without causing damage to retinal tissue. We'll move on to the third question of the set. Please look at the clinical photograph and answer the question. Which of the following is not appropriate in the management of this condition? Please note, it is not appropriate. A, azithromycin drops. Is it B, oral doxycycline? Is it C, tobramycin 1.5% drops? Or is it D, fluoromethalone drops? Your time starts now. Right? The right answer is C, tobramycin 1.5% drops. This is kind of a googly because the question was which is not appropriate. As you would know, it is a case of marginal keratitis, and it's treated with warm compressors, topical azithromycin and oral doxycycline help in improving the quality of the mebum. Topical steroids are also helpful as it is an autoimmune, as it is an immune phenomenon. And tobramycin 1.5% is a fortified tobramycin, which is extremely toxic and is not helpful in the situation. Let's move on to the next question. Please look at this photograph and tell me which of the following is not useful in the management of this condition, which is not useful. Option A, is it argon laser peripheral iridoplasty? Is it B, UBM? Is it C, ASOCT? Or is it D, is it selective laser trabeculoplasty? So the following is not useful. Right, time's up. And the right answer is D, selective laser trabeculoplasty, which is useful in open angle glaucoma, but it's not useful particularly for a plateau iris. And here, argon laser peripheral iridoplasty can help contract the peripheral iris and widen the angle. You can image the angle with ASOCT, and also UBM can be used to image structures behind the iris, as in the case of anteriorly rotated ciliary processes, ciliary body cyst, etc. And selective laser trabeculoplasty is not useful. Let's move on to the next question. Now, which of the following is not MIGS? Option A, is it GATT? B, KDB? Option C, PGI? Or option D, TRAB 360? Your time starts now. Time's up, and lots of acronyms here. The right answer is C, PGI, which stands for false glaucoma implant, and MIGS, as you know, stands for minimally invasive glaucoma surgery. And GATT stands for gonioscopy assisted transluminal trabeculotomy. KDB is a Kahoot dual blade, and TRAB 360 is trabeculotomy 360. All of these are mixed techniques, whereas PGI is a more invasive form of glaucoma surgery. Right? I think we have done 5 questions. Move on to the next quiz master. Thank you.
Well, you have to introduce one. Prashop, sir?
Yeah. So I have the pleasure of introducing Dr. Annapurna Kumar. She did her MBBS from St. John's Medical College, Bangalore, and her MS in ophthalmology from Mysore Medical College. She's a former professor of ophthalmology and currently a teacher at Arvind Eye Hospital, Pondicherry. And she has a very well subscribed YouTube channel called Hippies Ophthalmology Pearls with a lot of subscribers, more than 38,000 and 330 videos, 2 million views. And she has done daily quizzes for the past 3 years. So very well versed with her trade. And she also displays subtitles in 16 languages on her channel. She's proficient in PowerPoint and provides professional medical PowerPoint design and video editing services as well. So she wears many hats. Over to you, madam.
Thank you, Dr. Prashop, for that introduction. I also thank Dr. Shilpi and Dr. Bavankure for giving me this opportunity 2 years in a row. And I think we'll start without wasting any time, the rapid fire.
So today the team 1 is team champions. Team champions.
Yes, good evening, ma'am.
Good evening. Yes. So please introduce yourself.
Myself, Dr. Mohini. I am Dr. Samruddhi Jain. We are third year resident from MCH Chhatrapati Sambhaji Nagar.
Okay. So please be closer to the mic. And also this time, all
Yes, ma'am.
questions will not be displayed together. It will be one by one. Okay. So we are making it
Okay,
more
ma'am.
difficult. Okay. It should be of the
Yes,
semi-final.
ma'am.
So if you don't know the answer, say pass.
Yes.
Okay. If time permits, you can answer
yes,
it back
ma'am.
later on.
Yes, ma'am.
Okay.
And I will not be reading out the questions so as not to confuse you. You can read it yourself and process the question yourself. Okay.
Yes, ma'am.
So shall we start?
Yes, ma'am. Yes.
So your time starts now.
Pass. इसको opt कर देते हैं first. ये बोलना with जरूर है आगे में जरूर. With the root. Second is with the root. Landmark trial for RMD. First is ophthalmic. Yeah.
Pass.
PCV.
Don't waste time. You still have 2 more questions.
No, ma'am, the time is up. So you can attempt the question, but you will not get the either the positive or the negative marks.
The first one is, I guess, Octa, OCTA.
Okay. Fourth one is
Spot diagnosis. This is macular hole. No? Sure. Macular hole.
okay, and the fifth one?
Shawl baseline. No, those are exchange signing key.
Okay. So
Signing
let's
key.
look at the answers.
Iris processes.
Right. So the gold standard investigation for PCV is indocyanine and green angiography, not OCT angiography. And the second question, you can get half the marks because you answered with the rule, but we need the complete diagnosis. It's a simple hyperopic with the rule astigmatism. The 2 landmark trials for intravitreal ranibizumab are Marina and Anchor. This is an epiretinal membrane with a lamellar macular hole. I don't know. They just said macular hole, but I don't know. Should we give them half the marks? I don't know.
Basically, they exhausted the time, no?
Oh, yeah. Okay, fine. Yeah. That's right. That's right. And the last one, the arrow is pointing to iris processes. Yeah. So the second question, they get half the marks. So that
Plus
is
5 to them.
plus 5. Okay. Right.
All the best. We have two more sets of MCQs and one set of case-based for you. Okay?
Yes, ma'am. Thank you.
Welcome. The next team is retinistas. Please unmute yourself.
Yes, ma'am. Hello, ma'am.
Yes. Please introduce.
Ma'am, I'm Dr. Ruja, and I'm Vaishnavi. We are from KMC Mangalore.
Okay.
Welcome.
Thank you.
So are you ready?
Yes, ma'am.
So your time starts now.
Pass. This will be against the rule, ma'am. Eagle. No. ILM drip sign.
Time is up. Can get 1 second to answer. Okay. So the gold standard clinical parameter for visual performance is BCVA. You mentioned against the rule, I think. So that's again half the answer.
Yes.
Your third is right. It's the Eagle study. ILM drape sign is also correct. The last one is KF ring. Okay. So they get 2 correct answers. That's plus 20 plus half, that is 5. So 25.
20.
Yes. Well done.
Well done. Okay. So the next team in row is Team Epic Eye.
Good evening, ma'am. My name is Dr. Arpita Shringi.
My name is Dr. Preeti Singh.
We are from MJ Medical College, Indore.
Welcome.
Thank you, ma'am.
So are you ready?
Yes, ma'am.
So your time starts now.
Pass.
With the rule. With the rule.
With the rule astigmatism. Pass. Retinochisis.
Pass?
Yes, ma'am.
Okay.
So though most people do CTA or MRA, the gold standard is conventional cerebral arterioangiography. Again, you've said with the rule, so you've got half the answer right. Pulsar and photon trials are for the higher dosage of aflibercept. You said macular schisis, but they did not mention the myopia. Shilpi, you decide whether we should give them half the marks or
We'll give them the marks.
half the marks is fine. Yeah. And the last gonioscopic picture is silicone oil. I think, yeah, it's actually a little bit easy one. So you get half for question number 2 and half for 4. Is that plus 10, Shilpi?
Yes, ma'am.
Yeah. Okay. Okay. Nice.
So the team 4 is Shifa Eye.
Good evening, ma'am.
Good evening.
Hello.
Am I audible, ma'am?
Yes, you are.
Okay, so I am Dr. Muhammad Akhlaq from Patna Medical College, Bihar, and I have another teammate who has joined from another Zoom meeting, Dr. Anamika. I will be answering the questions.
Okay. So, are you ready?
Yes, ma'am.
Yes, ma'am.
Reduced vision due to pass. Plus 3.5. It is mixed astigmatism. Cat trial. It's a CRAO. Sorry, pass.
Okay.
Okay. So the gold standard for vision reduction due to ectasia is RGP lenses. Mixed astigmatism is correct. You did not mention against the rules, so we can give you half the marks. The landmark trial is not CAT, it is DRCR.net protocol T. Acute CRVO, you mentioned correct. The last one, you don't get any points. So that is 15 minus 5. Is that plus 10, Shilpi?
Yes, ma'am. Plus 10 to them.
Plus 10. Okay.
So the next team is Team Friends.
Hello.
Yes. Hello. Please introduce yourself.
Hello, ma'am. Actually, I cannot see my video. Am I audible?
You are visible also and audible also.
Okay. Ma'am, I'm Dr. Samvada, and my partner, Dr. Gaurav, has introduced himself from a different video, from a different login device.
Hello, good evening, ma'am. Am I audible?
Yes, yes, you are audible. So who is going to answer? Both of you?
Samveda will answer.
Okay. Okay, great. So are you ready?
Yes, ma'am.
So your time starts now.
Pass. Compound myopic astigmatism against the rule.
Pass.
Pass, ma'am.
Pass. Pass.
Okay. So, though we don't do it, traditionally the gold standard for confirmation of a viral infection is viral culture. The astigmatism, I think till now you're the first team that got it totally right. It's a compound myopic against the rule. That's right. Plus 10 for that question. The two landmark trials are View 1 and View 2. This is an acute solar retinopathy. So you see the subfoveal loss of ellipsoid zone and hyperreflectivity of all the layers. So, and the last one is angle recession, where you see a broad ciliary body band. So that is plus 10.
Plus 10.
Is that? Yeah, plus 10.
Plus 10.
Okay.
So, ma'am, you need to introduce Akshay sir now.
Yes. So it is my pleasure to introduce Dr. Akshay Nair, whose area of expertise is oculoplastic surgery and ocular oncology, and known globally for his pioneering work on mucormycosis. He has received multiple awards in AAO and APAO, AIOS, and received multiple travel grants, has numerous publications, and has contributed to many scientific textbooks. And it's great that he has featured in the top 2%, according to a paper published by Stanford University in 2022. He's the first non-American international member to be inducted into the AAO1 editorial board for a 5-year period. And he's an elected member on the executive council for the Oculoplastics Association of India and the Asia Pacific Society of Ophthalmic, Plastic and reconstructive surgery. Welcome, sir.
Thank you, madam. All right.
Okay. Shall we start?
Yes. So they would be answering on the, it would be team wise, right?
What, sir? Team wise only. Yes. So the next team for case based is Team Iconic. No. Team Champions, now you will be after the second set of MCQs that will say. So Team Iconic.
Hello.
Yes.
Ma'am, can you hear us? Good evening.
Yes, we can see you also. We can hear you also.
Yes, ma'am. Good evening.
Good evening. Please introduce yourself.
My name is Kasturi Dabole. I'm from Arvind Eye Hospital, Coimbatore. Currently in my first year. Sakshi Pole from Arvind Eye Hospital.
Which year? Which year?
First year.
Sir, these are first year students.
Yeah.
Qualified for semi-finals.
Wow. Well, if they have qualified for semi-finals, then I think their level will be good enough to get through these questions.
Chalo. All the best. Be closer to the mic, beta. Huh?
Yes.
So you will get 30 seconds time for 3 questions.
Yes,
okay. First, sir will just read the question. He will explain everything. And then questions will be asked.
Yes, ma'am.
Okay. So shall we start?
Yes, please. Okay. So this is a 28-year-old with complaints of drooping of the right eye since birth. And she says, let's ask the questions. And then her description is that my droopiness varies with my mouth opening, especially when I'm chewing and eating. So your set of questions regarding this case are, in familial cases, what is the inheritance pattern? The synkinesis here that we see exists between which two nerves? And this is seen bilaterally in 10% of the cases. True or false?
Autosomal recessive, 5th and 7th nerve, and
Okay.
true.
True. Okay. So you said autosomal recessive, 5th and 7th, and true. Okay. Can we see the answers? It is autosomal dominant, so that is incorrect. It is correct. The correction is between the 5th and the 3rd, the oculomotor and the trigeminal, and the condition is seen in bilaterally in actually between 2 to 3%, in less than 5% of the cases. You can, in clinics, you will see that only one eye will move. To have the patient have both eyes moving up and down is extremely uncommon. In fact, in 12, 14 years, I've seen just one case. So they get 1 correct and 2 wrong.
Okay, sir. So it is equivalent to then 0. It's a good sign.
All right.
Yeah.
Okay. Remember, teams, if you're not sure, you can pass rather than lose points.
Okay.
Okay. So team 2.
The next team is Team Symbiotes.
Good evening, ma'am. Can you hear us?
Yes, we can.
Yes, ma'am. Hello. Hello.
Hello.
Yes, ma'am.
Yes, please introduce yourself.
Myself, Dr. Arun. I'm from Jipman, Pondicherry.
And I'm Kalyan. I'm from Jipman, Pondicherry.
Both are final year students.
Okay. So shall we start?
Yes, ma'am.
Okay.
All right. So this is a 66-year-old female who came with complaints that she's been seeing this yellow little thing growing on top of both her eyelids for the past 1 year. It's gradually increasing and it's painless. So your questions regarding this is the following. What is being deposited here on the eyelids?
Cholesterol.
Okay. What percentage of cases are linked to lipid abnormalities such as dyslipidemia, hypercholesterolemia, or hyperapobetolemia? Right?
Pass, sir. Next question.
After surgical excision, over 50% of the cases show recurrence. True or false?
False.
You have
Second
time to
question.
answer the second. Yeah.
Second is pass.
Second is pass. You want to
All
attempt?
right.
Pass, ma'am.
Okay.
All right. So we see the answers. What is being deposited? Cholesterol is correct. 50% of the patients with this condition. So what is the condition called?
Xanthelasma.
Yeah, xanthelasma palpebrum is the correct answer. So 50% of these patients with xanthelasma have lipid abnormalities. So always it is a good idea to screen these patients and to put them on lifestyle change management or statins as per the physician's advice. And surgical excision is less than 50%, in less than half of the patients, recurrence is seen after surgical excision, more in the range of 20 to 40%. So you got 2 correct and 1 they passed.
Yes, so plus 20 to them.
All right.
Good.
Thank you. Thank you, sir.
The next team is G-Neck Boys.
Hello, ma'am.
Hello, good evening.
Good evening, ma'am. I'm Dr. Gahan and he's Dr. Vinayak. We are from Guru Nanak Eye Hospital, Delhi, ma'am.
Okay, which year
Which
student?
is?
The third year.
Final
students.
year.
Final year.
Okay. So are you ready?
Yes, ma'am.
All right. So this 18-year-old boy came with complaints of pain and swelling on the right eyelid since 3 days. And these were his imaging findings. Based on this, your questions are as follows. You will see the images in the subsequent slides. What organism is responsible for this condition?
Teasers.
Okay. What additional screening must be done in patients who present with this?
Fundus screening and
examination.
central nervous system, brain screening must be done for any central nervous system.
Okay. The third question is surgical excision of the residual lesion after medical treatment is needed in 50%.
False.
Okay, just don't move on. Do you want to clarify your second answer?
So we need to be checking if there's any neurocysticercosis, and we need to see if the intraocular cysticercosis, because we cannot give the medications if it's intraocular because of the inflammation, sir.
He can go into rapid phthisis also.
All right. Okay, so now we can go to the next slide. So tinea solium is correct. When we talk about additional screening is beyond the eye, and CNS screening was, I don't know, I leave it to Prashant sir and Shilpi. We were looking for neuroimaging.
I know, but they answered so well after that. Okay, I think we should.
So we can give it to them. And surgical excision is rarely needed, less than 10%. They got that right as well. So when they have all 3 right, final years are actually studying.
Yes. So that is what we don't want, only the answers. If your concepts are clear, it's okay.
Perfect.
Thank
Good.
you.
All the best for the next rounds.
Thank you.
So the next team is Refractonaut, the Refractonaut.
Good evening, ma'am. I am Dr. Madhav, third year resident from Nair Hospital, Mumbai.
I am Dr. Aman, third year resident from Nair Hospital, Mumbai.
Just to clarify, they are not in my hospital. I am a different Nair.
Sir, marks will tell.
All right.
No, it's okay.
So this is your case.
Yes, ma'am.
Okay.
Yes.
So this is a slit lamp photo of a 44-year-old male with a history of a rapidly growing lesion for the past 6 months. Now, based on this image, your 3 questions are as follows. What drug as a form of topical immunotherapy is useful in
interferon alpha 2b.
Okay. In this condition, what imaging technique is useful in evaluating the depth?
Pass.
All right. And vitamin A deficiency is a predisposing condition. True or false?
True.
You have time to answer the second question. What imaging modality is used to evaluate the depth of invasion?
Yes.
Did you answer or you're discussing?
No, sir, not that.
So you want to attempt, we will not give you any marks.
ASOCT, sir, anterior segment OCT.
All right. Okay. So we go on to the answer slide. Interferon alpha to be absolutely correct. Topically, either 5-fluorouracil or interferon alpha to be can be used in OSSM, except in invasive carcinomas. The depth of invasion is useful. The imaging modality in assessing the depth of invasion is UBM, because you remember these lesions are not optically clear. Then ASOCT is useful in the corneal extension or the corneal part where there is still some optically clear tissue through which it can see and assess the abrupt transition between normal coronary epithelium and OSSN. But for optically opaque lesions like this, a UBM will help in knowing whether there is scleral invasion or not. And you got the vitamin A deficiency right. It is a predisposing condition to this lesion. So they get 2 right and no negatives.
Thank you, sir.
Thank you.
So the last team for this is team Estigmates.
Good evening, sir. Good evening, ma'am. Good evening. We are from, I'm Krutin, Dr. Krutin from Arvind, Coimbatore, second year resident. I'm Abhishek from Arvind, Coimbatore, second year resident.
Okay.
Excellent.
So,
okay, so yes, your case picture is this. This is a 72-year-old elderly gentleman with a sudden onset of a droopy eye since 4 weeks. There is variation of the eyelid height seen through the day, and occasionally also says that he has double vision. Now, based on this image and this history, your questions and 30 seconds starts now. So, what bedside test is highly specific for this condition? All right. Name 2 antibodies commonly tested.
Anticholinesterase antibody, anti-musk.
Okay. And CT scan of the chest.
It's for thymoma.
CT scan of the chest is needed in young patients with this condition. True or false?
True. Thymoma.
So, letting me complete the questions, they've actually hit all 3 out of the park. The ICE test is highly specific for this condition, and in fact, the specificity of ICE-PAC test in ptosis exceeds, in ocular myasthenia, exceeds that of any of the 4 antibodies that are listed. Commonly tested ones are anti-acetylcholine and anti-MuSK antibodies. MuSK stands for muscle-specific kinase. Other rare or rarely tested antibodies, but with a higher degree of specificity, are anti-titin antibodies and anti-rhodin antibody receptors, or RYR. And as they said, thymomas are known to occur in the mediastinum, which actually cause the secrete the antibodies, and especially in children and patients under the age of 40. So younger patients whom you suspect to be myasthenics should always have a screening of the CT scan of the chest to rule out a thymoma, because in these patients, treatment is just a thymectomy and not putting them on anti-acetylcholinesterase inhibitors or steroids or immunomodulation. All right, so they got all 3 correct, so 30.
Yes. Great. So with this, we end with 1 set of MCQ, 1 set of case-based, and 1 set of rapid-fire round. So now this is time for MCQ second set. Request everyone to please refresh your Kahoot screens. Over to you, Prashop, sir.
Hello, that was a really absorbing, interesting session by Dr. Akshay. And you're back to the MCQs. The second set. Shall we move to the first question? Yeah, so look at the animal in the picture and answer the question, which of the following pairs of conditions? It's a pair of conditions, please note. Which of the following pairs of conditions have eponymous signs associated with this animal? A, metastatic neuroblastoma and cardiac keratitis. Is it B, Cogan-Rees syndrome and retrobulbar neuritis? Is it C, keratoglobus and tamoxifen retinopathy? Or D, sarcoidosis and base of skull fracture? Your time starts now. Time's up. The right answer is sarcoidosis and base of skull fracture. Sorry for you if you've chosen A, because only metastatic neuroblastoma can lead to raccoon or panda eyes, but cardiac keratitis has nothing to do with it. Gallium scan in sarcoidosis also shows a panda sign where you have uptake of gallium-67 in the parotid and lacrimal glands and the nasopharynx. And base of skull fracture can also lead to a periorbital ecchymosis, also known as panda eyes. That we move to the next question. Look at the picture, and this is an 82-year-old lady with a right upper eyelid swelling, not responding to warm compresses and antibiotics. Which of the following is the most appropriate next step in management? Most appropriate. The options are A, is it intralesional triamcinolone? B, is it LipiFlow? C, is it incision and curettage? Or is it D, excision biopsy? The time starts now. The right answer is D, excision biopsy. As you can see, the lesion represents a sebaceous gland carcinoma. It shows a lot of sinister features in that it's unilateral, painless, it's low growing. There are loss of eyelashes, thickening and rounding of the lid margin, and does not respond to treatment for meibomian gland disease. Let me go to the next question. Which of the following is not an appropriate treatment option for this condition that's shown in the picture? Is it option A, ganciclovir 0.15% ointment? Option B, acyclovir 3% ointment? C, moxifloxacin 0.5% eye drops? Or D, all of the above? Which of the following is not an appropriate treatment? Time starts now. Right? Go to the answer. The answer is all of the above. None of them are appropriate because this is obviously an adenoviral keratoconjunctivitis where there's not much of a role for antibiotics or antivirals. In certain trials, povidone and dexamethasone combinations in various strengths has been noted to be effective. And of course, topical steroids are effective in the treatment of epithelial infiltrates that involve the visual axis. Right? Move to the next question. Please look at the clinical picture and answer the question. Which of the following tests or signs is useful to evaluate this condition? Is it option A, pupillary snap sign? B, double hump sign? C, is it the snapback test? Or D, the ice pack test? Your time starts. Right, and the right answer is C, snapback test. This is a case of an ectropion where the laxity of the lower lid is assessed by the snapback. Move on to the next, last and final question. Please look at the fundus pictures in both eyes and answer the question, which is the most appropriate next test? The most appropriate next test. Is it A, MRI brain with contrast? Or B, MRI brain without contrast? Option C, is it a CT brain? Or is it option D, blood pressure? Your time starts. And the right answer is D, blood pressure. So this is a case of a hypertensive retinopathy from malignant hypertension. The first thing that you should do is check the blood pressure when you see disc edema. That we come to this end of this set of questions.
Thank you,
I
Prashant.
think we'll move on to
Yes, sir. With this, we end with the second set of MCQ, and this is time for a short commercial break. We are thankful to the His Highness team for all the financial support. So now we are again back to the rapid fire round. So I request Dr. Annapurna ma'am.
Yeah.
So teams get up again. It's time for the rapid fire round for the teams who played the case-based questions in the last set. So the next team is Team Friends. Sorry, you have played this round. So the next team is Team Symbiotes.
Hello, ma'am.
Hello. So are you ready?
Yes, ma'am.
Okay. So you will get 30 seconds time again, but for 5 questions. Okay. So your time starts now.
Vitrectomy. Vitrectomy. Compound myopic with the rule astigmatism. Ilia. Pass. Pass. Pigmented solbis. Sample acetylene. 5 is sample acetylene.
Fourth, you said pass.
Yes, ma'am.
Okay. So time is up. Let's see what are the answers.
So early vitrectomy, when the vision is very poor, the thing is, you didn't mention intravitreal antibiotics, but I think it's okay. We can give them that answer. The next one is the type of astigmatism. Yes, you've got it perfectly right. The 2 trials for aflibercept in CRVA or Copernicus and Galileo. This one, whether you said outer retinal atrophy or a geographic atrophy, we would have given you the marks. Now the last one, Sampolesi line, yes, that also they get it right. So 1, 2, 3, 30 points for them.
Great, good.
Yes.
Good.
Well done.
The next team is Team Refractonaut.
Good evening. Good evening, ma'am. Are we audible?
Yes, you are audible. So are you ready?
Yes, ma'am.
Okay, so your time starts now.
Yes.
Pass.
0. This is a simple myopic against the rule.
Pass.
CNVM. CNVM.
Closed angles.
Close angles.
And
Yes, and what?
You want to attempt?
Iris Bombay, I mean closed angles.
Closed
because,
angles.
yes.
Okay.
Okay, can we have the answers, please? So the gold standard for arteritic is a temporal artery biopsy. You got the astigmatism correct. The 2 trials for ranibizumab in RVO are Bravo and Cruz. Bravo for BRVO and Cruz for CRVO. This is, you said CNVM, but I can't give you this. This is a classic PCV. So you get the notched PEDs, the ring lesions, double layer sign, this thing. The last one also, I don't, Shilpi, they said closed angle. Actually, this is neovascularization with PAS. So I don't think we can give them that. What do you say, Shilpi?
It's your choice whether, I mean,
They said closed angle, so maybe half the marks we can give them at least for that. Yeah. So actually, they get that CNVM, they get -5 for that.
plus 10 for the simple myopic against the rule, and
Yeah,
plus
that is correct.
plus 5 for the last one. So it comes out to be plus 10.
10. Correct. Okay. Fine.
The next team is team estimates.
Good evening, ma'am.
Good evening. Be closer to the mic.
Yeah.
Okay. So are you ready?
Yes, ma'am.
Okay. I hope this time you will let us at least display the questions. Okay. Shalom. Okay. All the best. Just joking. Chalo, your time starts now.
Humphreys analyzer. Next question. Next question. Oblique astigmatism. Score. Pass. Foveal thinning. Outer retinal loss. Next, pass. Pigment. Pass.
Yes. Okay. So, ma'am, let me display the answers.
Yeah, please.
Okay.
So yeah, you said Humphrey analyzer, so we can give it to you, no problem. Basically, standard automated perimetry. Your astigmatism, you didn't mention it right. The trials are RIDE and RISE. But I think they mentioned score or something. So do we cut marks for that, Shilpi? I don't know.
Okay, then they said pass. Okay, then give. Let's give. Okay.
Right. And the fourth question, it's BRAO. They did mention something, but I don't know. Again, that you take a call on that. Last one, of course, they didn't answer. So
They said the inner layer reflectivity, and so we can give the half marks to them if.
did they say inner layer reflectivity? I didn't hear that.
Yes, yes.
If they did, then they can get okay, 5 plus 5. So 10 plus 5, 15.
And -5 for the second one.
Yeah. Did they? I don't know. I forgot.
Oblique.
Right. You said oblique. Yes, -5 for that. Right.
So plus 10 from this round.
No.
So the next team is Iconic.
Hello? Hello?
Hello.
Yes, ma'am.
So are you ready?
Yes, ma'am.
Okay. So your time starts now.
Pass. Biopsy, actually, skin biopsy.
Okay. Second.
Compound with the rule astigmatism. Pass. True. Okay, spot diagnosis. PD. Pigment epithelial detachment. Please look at the picture. Always line. Pass.
Okay.
So they mentioned tissue biopsy. I think for first years that itself is great. Probably we can give them half the mark. Shilpa, I don't know. You take a call on this.
Sure, ma'am. Sure, ma'am.
Okay. Then the thing is the astigmatism. They mentioned compound. They mentioned with the rule. They didn't mention hyperopic. So I don't know how much to give them. Again, you take a call on that. 4 marks actually. So.
Third, they passed.
Third, they passed. Fourth was wrong, actually. That's a hydroxychloroquine retinopathy. That's a typical flying saucer sign. And the last one is the prominent Schwalbe's line. That is that, what is that called? Yeah, posterior ambrine toxa. Yeah.
Peters anomaly.
They mentioned Schwalbe's.
Accentual.
Yeah, but they only mentioned the Schwalbe's line, ma'am. So shall we give or not?
We can give half, actually.
Okay. So they get plus 10 from this round.
Okay.
Thank you, ma'am.
Okay. All the best. So the last team for this rapid fire round is GNEC boys.
Yes, ma'am.
So are you ready?
Yes, ma'am.
Yes, ma'am.
Okay, your time starts now.
Non-nutrient agar with E. coli overlay, ma'am. Compound myopic astigmatism, ma'am, against rule. Pass.
Lamellar macule. Lamellar macule.
Ma'am, iris dialysis, iododialysis, ma'am.
Okay. Let's see the answers.
So your first one was absolutely right. You get plus 10 for that. You mentioned partly, I forgot which part you mentioned.
You said compound against the rule.
Against the rule is correct. The compound is wrong. This is a mixed astigmatism. So half is right, half is wrong. So I don't know. You see how to grade that. The trial for melanoma is COMS or Collaborative Ocular Melanoma Study. The diagnosis of OCT was wrong. This is it's not a lamellar hole, it's a macular pseudo hole. So if you can see there's an ERM, a punched out lesion, there is no intraretinal split. So that itself is a pointer towards a macular pseudo hole. Okay. And there's no loss of tissue. And this is a case of aniridia, actually. Okay. Yeah.
So plus
Should be-
10 to them, plus 10 for the first question, plus 5 for second, and minus 5 for the fourth.
Oh.
Plus 10. Okay. So with this, we end with the rapid fire round, and now it's time for the case-based round. Akshay sir?
Present, ma'am. Yes.
So teams, are you ready? So the next team is Team Epikai.
Good evening, ma'am. My name is Dr. Arpita Shungi.
I'm Dr. P.P. Singh from MGM Medical College, Indore.
Okay. So are you ready?
Yes, ma'am.
Okay. So here is your first. Here's your case.
Yes, sir.
What's up?
Here is the case.
Yeah.
So this is a 53-year-old lady who came with twitching of the muscles seen on one side. It has a sudden onset since 3 months and it is paroxysmal, which means it happens on its own without any trigger or without any prodromal symptoms. It happens on its own at any time of the day. Based on these findings, your questions are: what would be the investigation of choice in the first clinical encounter with the patient with this?
Pass.
All right. Where is the most likely location of a vascular compression if present in this condition?
Pass.
All right. And the most effective treatment for this condition is electromyostimulation at the affected points. True or false?
Pass.
All right. So, okay. So, what do you think is the diagnosis first?
Sorry, sir.
No problem. Then try to remove the diagnosis in most cases. Yeah.
The facial nerve palsy.
So this is twitching that is seen. This twitching on one side of the face in itself is hemifacial spasm. In hemifacial spasm, any patient that you see for the first time or with the recent onset, you must get an MRI or an MRA, because in the second question you can see there could be a vascular compression of the facial nerve at the brainstem at the root, where the facial nerve exits from the brainstem. And finally, the most effective treatment is botulinum toxin into the affected muscles, which causes the relaxation of those muscles in spite of the neurological stimulation, and that is the most effective treatment when there is no vascular compression. All right, so this is a good learning point for y'all, but at least y'all didn't get any wrong.
Thank you so much.
So the next team is Team Retinistas from KMC Manipal.
Okay, Mangalore, ma'am.
Sorry.
All right, so thankfully retinistas, I don't know if they get a retina too. Let's see. All right, so your case and the images are that this is an 8-year-old girl who came with recurrent orbital swelling causing this amount of proptosis. And she has recurrent episodes which also increase whenever she has a cough or a cold or other respiratory infections. And you can see the CT and the MRI on the right and left respectively. Now, based on this, your questions are: what is the common name for this low flow vascular malformation?
Lymphangioma.
Is correct. What drug is most commonly used now as the first choice of intralesional intervention?
Pass.
All right. In this condition, macrocystic lesions have better outcomes compared to microcystic lesions. True or false?
False.
False. All right. You have a choice for the second question. You have an answer?
So maybe a sclerosing agent.
Okay. So we'll go to the answers. The correct answer for the name of this condition is a lymphangioma, also known as a venolymphatic malformation. The first drug used as an intralesional sclerosant agent is bleomycin. So I'm okay giving half marks because they really said it was a sclerosant. But they got the last one wrong, which is macrocystic lesions actually have better outcomes compared to microcystic lesions. So that's 1.5 right and 1 wrong.
So plus 10.
Thank you. Thank you.
Okay. Yeah. The next team is Team Friends.
All right. So where is the team?
Hello.
Where is your partner?
So we had actually logged in from 2 different devices. So
Yeah.
Hello.
Yes.
Okay.
Are you ready?
So your case is as follows. This is a 65-year-old male who came with a 3-month history of progressing bulging of both eyes, along with redness. As you can see, there's a lot of chemosis and pain. Now, based on this, you have to make your diagnosis and answer the questions that I'm going to pop up. The questions are:
You both are muted.
Hello.
Yeah.
we
Can
can
start?
hear you.
Yes. Okay.
So, what is the name of the curve used to chart the natural history of? Correct. What is the insulin growth factor blocker which has received FDA approval?
Ma'am.
Okay. Your third is: in surgical management of this condition, the order of surgery is decompression followed by strabismus and then eyelid surgery. True or false?
True.
True. All right. Can you give me the name again of the drug? I didn't get it right.
Teprotuzumab. Teprotuzumab.
Okay.
All right. Okay. It is a tongue twister, so I'll give it to you. It is teprotumumab or Tepeza. Rundle's curve is correct, and the order of the surgeries is correct. It's always orbital decompression followed by strabismus and then eyelid surgery, because decompression can induce strabismus, which can be corrected by strabismus surgery, which in turn can cause a malposition of the eyelid, which is then finally corrected with eyelid surgery. So our second team to get the case-based questions, all three correct. Special points for, I mean, rather, special congratulations for getting correct. Yeah, it's a relatively newer drug, not yet available in India.
Thank you, sir.
Welcome. So the next team is Team Champions.
All right. Where are the champions?
Yes, good evening, sir.
Okay. All right. So your case is a 72-year-old male with a 1-year history of an eyelid mass. As you can see from the morphological features, how it looks. And it is rapidly growing in the past 3 months. Considering this is an Indian patient that I have seen in the OPD, your likely diagnosis should be in your mind, based on which we'll ask the following questions. Based on the location of this lesion, which lymph nodes would be first affected in cases of regional spread?
Submandibular.
Is correct. What is the type of spread associated with this lesion where the tumor spreads within epidermis rather than invading deep tissue?
Pass.
Okay. The lower lid is the most common location for this type of tumor. True or false?
True.
Is incorrect. So, do you want to take a go at the second question with no marks, of course, since time is up? All right. So, can we see the answers? Firstly, what is your likely diagnosis that you've made?
Papilloma or squamous.
Okay. So, if there's a rapid growth in 3 months, that always suggests there is a malignancy. And also, look at the destruction of the eyelid margin, the loss of tissues, the ulceration, and the yellowish hue. All of this points to a sebaceous gland carcinoma, which is the most common eyelid tumor in the Indian subcontinent as compared to a basal cell carcinoma, which is seen in the West. You got it right. The submandibular nodes are the most likely to be affected in this case because the submandibular nodes drain the medial 1/3 of the lower lid, and the lateral medial 2/3 and the lateral 1/3 goes to the preauricular nodes. The spread that is associated with this is Paget's spread, which is why we need something known as a map biopsy. And the lower lid is the most common, is false, simply because the upper lid has more
Sebaceous
glands. So more sebaceous glands feel more likely with correct tumor. You get 1 correct and 1 wrong with 1 pass. So that's 5, right? Shilpi, you're on mute.
Yes.
Yeah. So 5 marks to team.
Yes. +5.
That's 5.
Yes. So the last team for case-based round is Team Shifa.
All right.
Good evening, sir.
Good evening. All right. So now, since I know which set is remaining, the questions here may be a little long, so I'll use my discretion to give you a little more time to answer because the questions will take a little long. Your case here is as follows. This is a 78-year-old male with vision deterioration seen over the past 3 months. That was an initial picture with the OCT, and subsequently, as 3 months later, when he did not take any intervention, that is the ultrasound that shows that lesion. Make your diagnosis or likely diagnosis in your mind and answer the following questions. Based on your diagnosis, what is the most common site for metastasis from this lesion?
It is the lung and bone.
So there is a mnemonic called TFOSM, which is thickness, subretinal fluid, orange pigment, margin touching the disc. All this mnemonic is to differentiate this lesion from what other common lesion?
Benign lesion that I'm not able to remember that the benign lesion. Sorry.
Okay, we'll move to the third question. I remember this question is a little long, so I'll give you an attempt to answer the third question. Shaggy appearance of the retina overlying this lesion on OCT is due to photoreceptor damage. True or false?
It is false.
It is false. All right. So unfortunately, you've got 2 wrongs and 1 pass here. The answers for this lesion are this. What is the diagnosis first?
Choroidal melanoma.
That is correct. So choroidal melanoma actually most commonly spreads to the liver, which is why an ultrasound abdomen and a CT abdomen is included in your metastatic screen every time. The mnemonic TFS, TO4SM, where you look for thickness, fluid, orange pigment, and symptoms, and whether it is touching the margin, is to differentiate it from the benign corresponding lesion of the melanoma, which is at nevus. You were in the vicinity, but I needed the word. And the shaggy appearance of the retina overlying the lesion, as you can see, this OCT, is because of the photoreceptor damage. So that is 2 wrongs. So that will be -10.
-10. Yes. Yeah. So with this, we end with 2 sets of MCQs, all sets of rapid fire and case based. So we are remaining with 5 questions in the third set of MCQs. So over to Prashop, sir.
Hello, welcome back. And we are going through the last set of MCQs.
Just remind to refresh your Kahoot screens, please. So here we go with the last set.
Right. Which of the following procedures are useful in the treatment of PACG? The options are A, ALT, B, SLT, is it C, ELT, or is it D, none of the above? Your time starts now. Which of the procedures are useful? Right, time's up. And the right answer is D, none of the above. All of these procedures are useful in open angle glaucoma. So argon laser trabeculoplasty is ALT, selective laser trabeculoplasty is SLT. A newer experimental modality is excimer laser trabeculostomy, and all are useful only if the angle is open. Go to the next question, please. Right. Which of the following can be used in the treatment of diffuse OSSN? Your options are A, mitomycin C 0.4%, B, 5-FU 10 mg per ml, option C, both A and B, or is it option D, none of the above? The time starts now. Right, time's up. And the right answer is 5-FU 10 mg per ml or 1%. And the game here is of mathematics. Topical chemotherapy for ocular surface squamous neoplasia is mitomycin C 0.04% or 0.4 mg per ml, or 5-FU 1% or 10 mg per ml. Let's go to the next question. Please look at the clinical picture and the histopathology and answer which of the following is true about this condition. Is it option A, autosomal recessive CHST6 mutation? Option B, autosomal dominant TGFBI mutation? Option C, autosomal recessive TGFBI mutation? Or option D, autosomal dominant CHST6 mutation? Time starts now. Time's up, and the right answer is A, autosomal recessive CHST6 mutation, which stands for carbohydrate sulfur transferase 6 gene. And The condition is macular corneal dystrophy, which is stained with an alchin blue stain, and it's an autosomal recessive. Let's move to the next question, please. Right, this is an OCT image. It's a diabetic gentleman with a central retinal thickness of 600 microns. Which of the following is the most appropriate line of management? Is it option A, vitrectomy and ILM peeling? Option B, intravitreal anti-VEGF? Option C, grid laser photocoagulation? Or is it option D, intravitreal dexamethasone? Your time starts now. Right? Time's up. And the right answer is option A, vitrectomy and ILM peeling. And this is obviously a macular edema associated with vitreomacular traction. So in diabetic macular edema with vitreomacular traction, vitrectomy is the procedure of choice. And let's go to the next question. Which of the following is true about convex lenses? Some optics here. Is it option A? The image size is always smaller than the object size. Option B, it can form virtual images. Option C, the images produced are always inverted and real. Or is it option D, none of the above? Time starts now. Time's up. And the right answer is it can form virtual images. So convex lenses are plus lenses. They usually produce inverted and real images, but if you move the object to a point that is closer than the focal point, you can get magnified virtual images. And move to the next slide, please. So these optical diagrams will show you that when the object is closer than the focal point, you can get virtual direct magnified image. And that is in the last case 6. With that, I think we've come to the end of our questions.
Thank you. Thank you, Dr. Prashok. Wonderfully taken us through all the questions, all the quiz masters, Dr. Akshay, Dr. Annapurna, Dr. Prashok. So it was quite a learning experience for even us now. Rather, I think as I'm growing, I need such revisions more frequently. Thank you. So I think before we come to the finals of it, until the backend office is ready with the summation of all the scores for at least in the private practitioner category, can I request all the team members to join us on the Zoom platform for having small chat? And if some of the mentors, whoever have logged in, we would like to acknowledge your presence. So request all the mentors who are with us right now to please also join us on the Zoom platform, get their audio video on. Okay, good. So I'd say I think we can have a small chat. I think Team Iconics, where are you from?
Hello.
Yeah.
Sir, we are from Arvind, Coimbatore.
So where is your boss? Who is your mentor?
Dr. Chandrasekhar, sir.
Chandrasekhar, sir, where are you, sir?
Sir, hello, sir. Actually, they are mentored by the junior doctors. I came in, I am very proud of this team because they are first years, sir. They have not completed 1 year also, and they have completely, I'm happy that they have come to the finals. That will be a big booster for them. So we have got junior people mentoring. We had about 3 teams in semifinals. So I thought because they've come to semifinals, I'll just start mentoring them. But it was only yesterday I started. Congratulations to them for having reached this far, sir. Thank you,
It
sir.
is something like they said, like father, like son, you know.
Like children.
So
Yes,
like
sir.
mentors, like, you know, like the students naturally will be awed by it. So Akshay, you can have a small chat with this small people, this young team. Yeah,
Yes, but
first year
before that,
residents.
you should also, you know, they are all logging in virtually. Residents are very short of time. So as a gesture, you should always, now next time, Swiggy something to eat to all the participants and quiz masters.
Yeah, that's a nice option. But I think, Akshay, then next time you will be asking me for some, something to win
Never mind.
as well.
I know.
Akshay sir is asking this since our 6 seasons, and you never ever do that.
My co-host is ditching me for you. Okay, so fine. So meanwhile, we have the top three private practitioners. It's going to be Q, Seed, and Win. Again, the same familiar names. Please do join us on the Zoom platform. We will also love to have small chat with these people who are habitual winners in our private practitioner category. Please do join us on a Zoom platform. You can raise your hand on the Zoom screen so that you will be upgraded to panelist. So meanwhile, can we have the screen stop sharing the screen? So who is the next team now? Where are the teams gone? Team Friends, are you there with us?
Team Friends is two friends separate.
Iconics.
Everyone, please log in. Please
log in.
Iconic,
We'll have
how
small
is
chat.
the level of the questions? Since you all are first year residents, how did you all find the the level of the questions?
Yeah. So what do you say? Team Iconics a frank admission.
should ask them ki I mean for them definitely, but yes, hats off ki being first year.
They played
They
fantastic. No,
they
at
definitely
first year
knew
I
more
was
than
so
I knew in
lost
first year.
into ophthalmology. I didn't understand what is retina, and these people are answering the quizzes so well. I think seriously, and hats off. Congratulations to the mentors, Prida. I should really congratulate them as well. So second
I'm
team.
actually curious as to know how these first years, because generally first years have to do a lot of, grunt work, how they manage to find the time to read so much so as to be able to come to these semifinals. How do
Are you
you?
first year primary DNB or MS? Or are you
So primary DNB.
primary DNB? That's great.
Laudable, seriously laudable. Huh? As I said, I hope DC sir has not leaked in some questions.
No, sir. Actually, what happens now? I take regular classes. My classes are itself by quiz and Kahoot only. We have got about 130 Kahoots. I periodically take, and they have put in lot of efforts. I don't take credit from them. And somehow, yeah, actually, to select for the state conference, they stood second. It was Krutin who got the first place. And last time, Krutin came second in Big Q also, sir.
Yeah,
Yes, sir.
Chalo, let's move on to the next team. I think we see Epikai. Why don't you introduce yourself, Team Epikai, once more for the sake of audience?
You are muted.
Muted, better.
Good evening, sir. Good evening, ma'am. My name is Dr. Arpita Shringi.
Good evening, sir. Good evening. Myself, Dr. Preeti Singh. We are from MJ Medical College, Indore.
We can have a small chat. Dr. Annapurna ma'am, out of 10 teams, 3 are from Arvind. So someone outside Arvind, you can have a small chat with these young girls. Who inspires?
So, which year are you?
Third year residents.
Third year. Very nice. So I think you've done very well coming up to semifinals. And what is your inspiration to read? Or rather, who is your inspiration?
And actually, our consultants, our teachers, they always motivate us to see cases, new cases, and go and read about that case. And
Yeah, that is the best way to learn. You see a case, you go back and read up. That's the best way to learn. Very nice. Very well.
Our mentor is Dr. Shweta Wale, ma'am.
She's there.
Oh, Shweta ma'am, please do log in. Get your video on, ma'am. Shweta ma'am, is she there on the group? Yeah. दिख रहा है attendees में Sai, can you upgrade Dr. Shweta Walia ma'am? She's in the attendance list.
Yeah, done already.
Okay. Shweta ma'am, please do log in. Meanwhile, Vinit is again from a private practitioner category. Vinit, कितना पैसा जमा कर रहे हो भाई? आप ब्रेन टीजर्स का पूरा पैसा आप ही ले जा रहे हो. Akshay, this guy, यार इसका कुछ करो है. Every quiz he is winning and everything he is telling off from our kitty of brain teasers.
इवनिंग ओपीडी शुरू कर दो अच्छे से.
He's still in his OPD. Are you in your OPD?
No, sir. I am in my library.
He is an SR in RPC.
Oh, okay.
Okay, good. Vinith, भाई कैसे क्या करते हो इतना पैसे का, ये बता दो. RPC otherwise also pays you a lot. Then why are you?
क्या करोगे इतने धनराशि का?
हाँ, नहीं, with all this, so much money RPC is already paying. Why are you after this money of brain teasers, yaar?
Well, actually, more than money, it is like, it isn't just an opportunity once in 2 weeks to get something of the gist of the question. Because during SRC, we don't really read that much. So it's just to get into things, get back into things.
And I think the thrill of quizzing is always there. So.
Akshay, he thinks beyond money, yaar. What do you say? Bombay wala people. Any comment on that?
No, it's a thrill of quizzing, and I agree with Vinith that kick you get when you're participating in a quiz, the joy of being the first to press the right answer correct, all of that gives a different high. So yeah, it's good.
Yeah, it is the fun. The thrill is the right word.
Yeah. Yes, sir.
It's also the how you handle disappointment, how you missed out. You knew the answer, but you couldn't answer it. How
Yeah,
you handle
that's what happened on the last question itself.
Good. We have another person in private practitioner. Again, Q. बता दो भाई. Prashobh, again, this guy is like you people, every time he will take off something from our kitty of brain teasers. Q, please introduce yourself first.
Good evening, sir. Good evening, ma'am. I am senior resident from AIMS Raipur.
Games wale.
All senior residents taking away all the prizes from other people.
Yeah.
Last time I play as a postgraduate and I am the finalist. I was the finalist.
Last season. Correct. Very good. Well played. Keep up your interest. Your interest and still participating means a lot to us as a organizing, as a host, because people like you inspire us to do more and raise further the bar of this particular quiz. Thank you for continuing with us.
Thank you.
Congratulations once more. Okay. So we have other teams with us right now. Do I see Dr. Shweta? Any mentors are there with us? Yeah, Team Astigmatis. Come on.
Sir, we've got DC sir. He's always motivated us, and he is the one who pushes us for everything.
Seriously. See, if every one of you from Arvind keep on boasting and keep on, flattering him, his sugars will be very high for today. He will have to have a few more dosages of insulin.
All right. Yes, sir. And they will cool it down, sir, actually.
Good.
How did you get your name? I mean, this is a really creative name, Astigmates.
Actually, it was my father named it. He wanted to name Kevin, but then my grandmother apparently didn't like the name Kevin, so they put Krut.
No, I'm not talking about your name. I'm talking about your team's name.
Oh, Astigmates. I don't my name. No,
your name is also interesting.
Astigmates was ChatGPT.
ChatGPT.
You should never admit to using ChatGPT. We came up with this.
The secret to using ChatGPT is never admit it.
Yeah, the first rule of ChatGPT is there is no ChatGPT.
But he's still in an institute where ethics and truthfulness is the prime thing which they are being cultured with.
So sir, you and I are also from same institute.
See, it is the world when we move out of this world, out of that institute, that is the time people like Akshay Nair become what is Akshay Nair.
Last quiz, last season.
सर छोड़ने नहीं वाले, फिक्र मत कीजिए.
You can get Swiggy for him next time.
Next time.
We'll go.
Today only.
Chalo. Any other teams?
This team, Astigmates, when we were conducting the case-based questions, sir was not reading only the questions and they answered.
I know. DC man's preparation. I know.
Thank you. Thank you.
So, Epikai, come on. We had a chat with you. Any other teams with us right now? Or everyone has rushed for the dinner?
So our mentor, ma'am, Shweta ma'am, is there. Please accept her request.
She's not able to join, sir.
Why?
She put a request for joining. Please accept.
Sai, can you help them out?
Doctor, she refused to promote herself, doctor.
Dr. Shweta Walia has also raised a hand.
Yeah, but she's refusing to promote herself as a panelist. I'm trying to.
Dr. Shweta ma'am, you have to
Accept it.
accept that invite to.
Okay, now she's accepted.
Yeah. Madam, आ जाइए आप.
Even Jeb Bhaskaran sir wanted to.
Yeah, Dr.
Good
Bhaskaran.
evening.
Also. Yeah. Welcome, Dr. Shweta ma'am.
Good evening, Dr. Prashant and Dr. Shilpi. Good to see you.
Thank you, madam, for being with us. We are really thankful and we are inspired by mentors like you and the DC sir, who at this hour are standing so strongly behind their teams and watching them all throughout the live team. So your commitment speaks a lot, and naturally it contributes to the inspiration for the students and their performance, I believe. So Annapurna ma'am, Shweta Malia is a professor in MGM Medical College. A small chat with her.
It's nice. Good evening, Dr. Annapurna.
Good evening, ma'am. How, according to you, how were the questions overall? Did you feel they were too much, too less, or like Goldilocks just right?
No, actually, they should have, all the student must have exposure to all sort of these questions, be it neuro-ophthalmology or glaucoma, or they should have exposure to everything when they are doing PG. And it is during this time only they are exposed to theory. After that, they'll not have time to read anything. So they must be master, and they become master when they participate in such quizzes and compete with other colleges. They are motivated to read more and excel. Definitely, the such platforms are very, very good and help them to improve.
It's nice because in our time we didn't have all this, you know. There was so it's really good. The PGs that we are this day and age are very lucky actually.
So Professor Shweta Walia is Chairman Scientific Committee of Madhya Pradesh State Ophthalmological Society, and she has started a lot new initiatives for the Madhya Pradesh State postgraduates. I keep her following her silently and try to copy few of them for our ARC as well.
Thank you, sir. Thank you.
You.
So recently we are doing a fishbowl discussion series in which second year PGs, we had asked them to send the cases, and the best cases have been selected. And one of the best is presented by second year PG. And in this, the inner circle for discussion is by the second year and outer circle is by third year. So first second year discuss the case, and then third year discuss, and then experts give the input. So it's a 1 hour session, and it is all PGs who are discussing. No question and answers from the teachers. It is actually the PGs. So this was very, very appreciated. Recently we did one episode, and second is coming on 18th June.
Thank you.
So
nice ideas. I might copy it in the next season if I get an opportunity to be part of it.
you will definitely get. You are a born leader.
Thank you, ma'am. Thank you once more.
Thank you, sir.
We have any other people with us? Any teams? I think it's 9:10. I think most of the students have rushed for their dinner, and already Akshay has already put in a thought process. And once you have a thought process of food, the salivation and all that gastric hormones have started secreting. So most of the students seem to have rushed back.
Prashant sir, can I give one comment?
Please, sir.
Having watched these so many seasons, my impression is this prelims, prelims, quarters, and semis. They read almost all of ophthalmology, and all the PGs who have taken part in this, no sir, they find it easier in their university or the DNB exams, and they don't have difficulties in passing. Touchwood, we have been having 100% results. Annapurna madam is also there from Arvind. So it has been a very good exposure, and it motivates them to read so many things, sir, which are not exactly quiz. They are very important for their practice and every exam and all that. That's what I felt. And thanks to you, and it is motivating even us to come and join and learn. Thank you, sir. Thank you, and Shilpi. Thank you, sir. Thank you,
for
sir.
those kind words. In fact, We have Team Shifa. Come on, please.
Sir, I
Good.
welcome my mentor, Professor Sanjeev sir, who is my inspiration, my mentor, my guide. He has just joined the Zoom platform.
Acha, Sai, can you upgrade him, Dr. Sanjeev Kumar?
Just
Yeah, please.
Actually, I think he's already on the platform. He has to put on his video and audio. I can see his name there.
Yeah. Sir, आप वीडियो ऑन कर
they're on the
दीजिएगा. नहीं, नहीं, I don't see him on the.
Actually, I am seeing him on my screen.
प्रोफेसर संजीव कुमार सर, आपका ऑडियो वीडियो ऑन कीजिएगा. हेलो. हाँ, आ गया. ऑडियो ऑन कीजिए सर. हेलो. नहीं, सर का ऑन करना. नेक्स्ट डेट का 18. हेलो. संजीव सर, प्रोफेसर संजीव कुमार सर. हाँ सर, अभी आ गए हैं आप. ऑडियो ऑन कीजिएगा.
So good evening to all of you.
थैंक यू सर. प्रोफेसर सर, आप आ गए अभी. बच्चों के पीछे आप इतने स्ट्रांगली खड़े हैं, तो नेचुरली आपकी टीम भी सेमीफाइनल्स में आई है. कैसा लग रहा है आपको?
हाँ, बहुत ही अच्छा लग रहा है क्योंकि वो दोनों ही काफी लेबोरियस हैं हमारे, है ना। और आप हमारे सीनियर हुआ करते थे संकन विद्यालय में. मैंने फेलोशिप वहीं से किया है, हम लोग मिले भी हैं और बात किया उन्होंने किया है. तो दोनों ही काफी अच्छे. मैं थोड़ा लेट हो गया, मैं क्लिनिक में था, लेट हो गया थोड़ा.
जी जी.
तो आई एम सॉरी फॉर दैट. लेकिन ये बहुत अच्छा कर रहे हैं आप लोगों ने, ये है ना, ये होना चाहिए. और ये काफी मोटिवेटिंग है. मतलब आई बात इमेज टू सी कि मतलब मुझे बिना बताए हुए पहले इन लोगों ने पार्टिसिपेट किया, रिक्वेस्ट किया कि सर आप उसमें हैं, आज काइंडली ज्वाइन करेंगे. थोड़ा सा मैं लेट हो गया, है ना. लेकिन बहुत ही अच्छा लग रहा है कि आप लोग से मिल करके बात करके, और बहुत ही अच्छा है.
थैंक यू.
यू आर डूइंग अ वंडरफुल जॉब.
थैंक यू सर. ये हम तो नहीं काम करते हैं, हम तो सभी लोगों को, बड़े बड़े टीचर्स को, जैसे अन्नपूर्णा मैम, प्रशोभ, अक्षय, इन सबको साथ में लाने का काम हम कर रहे हैं. बाकी तो सब मेहनत तो ये तीनों लोग करते हैं जो क्विज मास्टर्स होते हैं बेसिकली. बट बीट हम अच्छा लगता है ऐसे अच्छे वर्ड्स सुनने के लिए. और आई स्टिल रिमेम्बर यू फ्रॉम एसएन. देयर इज नो सेकंड थॉट अबाउट इट. अभी मैं इतना बुढ़ा नहीं हुआ हूँ कि इतनी मेमोरी. But thank you for their being there for the team Shifa, and we are sure with your guidance this team will make it into finals. We wish them all the best. Thank you.
Thank you so much. Thank you, sir.
Thank you, sir, Professor sir. ठीक है. I think now it's time for us to say sign off for today's episode. We had a small chat. We had a wonderful discussion and wonderful session, and not only quizzing but also learning from this quiz master Prashobh, Akshay and Annapurna ma'am. We are really thankful for all the efforts you have taken for creating such a wonderful experience for all the postgraduates. So now it's time for us to sign out. So the second semi-finals will be on the 18th June with next set of 10 teams, which we have already announced on the groups. Till then, let us all chill and relax and have a good
Good night.
Thank you, sir. Bye-bye.
Good night.
Bye-bye.
Good night.